Hi everyone, I'm Dr. Catherine, your OBGYN. If you are giving birth during this pandemic, you may be feeling worried about many things. Well, I'm here to put you at ease with some tips. While the idea of going to hospital can be scary, I can assure you that hospital is still the safest place to give birth, and your chances of being infected with COVID-19 in the maternity and labor ward is small. Most of the hospital will require you to do a swab test before being admitted for delivery. So, the flow of admission might be delayed in view of waiting for the results. But if you are feeling unwell or having the urge to bear down, the doctors will attend to you immediately. Your partner might or might not be allowed to accompany you during the hospital stay depending on the hospital policy. So, today I'll be giving you tips on preparing for labor and delivery during the lockdown. Best if you start preparing from 32 to 36 weeks before being admitted. Pack the necessities, light and minimal, as you might need to carry it alone. If you go into spontaneous labor, the hospital stay will be short. If you have an induction of labor, most likely you will have a longer hospital stay, 5 days, depending on whether it's a successful one or not. If it's an elective cesarean section, then you will be in the hospital around 4 to 5 days. Let's get started. Prepare a hospital bag for the mother and another bag for the baby. First, we have to prepare the antenatal book, IC, and also your admission form if you have one. Antenatal book, IC, and also some minimal cash. Prepare a toiletry bag, preferably travel size and small. Your shampoo, lotion, body wash, toothpaste, toothbrush, comb, scrunchies. Don't forget to pack your phone, charger, power bank, and earphones, because during this pandemic, your partner might not be allowed to be with you during the hospital. This is the only and best way to communicate with your family, and of course, taking a lot of pictures of your newborn and to capture the early memories. You will also need to pack your towel, a few undergarments, use a disposable panties, preferable a larger size so that it will be more comfortable, and you can dispose it after use. So if you are using your undergarments, your bra, preferably using a nursing bra, because it has clips and you can remove it during your breastfeeding. You might need a sweater because it can get really cold. Bring your socks or compression stockings if you have been using it during your antenatal period. Keep a pair of clothes for discharge. I totally understand if you want your clothes to be Instagram friendly, but the best would be still some loose tops and batik sarung. For my Muslim friends, don't forget to bring your tudung. Get flip-flops or your slippers which has good grips. The hospital provides regular meals. You can bring your favorite snacks and biscuits and nutritional drinks because you might get really hungry after your delivery. You can also bring along water bottle which has straw that you can sip so that it will be easier when you're lying down after your delivery. Don't forget your cutlery sets and also a mini flask for hot drinks. If you are on any medication during the pregnancy, don't forget to bring your pills, your injections, and also your inhalers if you have one. If you are allergic, bring along your allergy card. If you are wearing contact lenses, bring your glasses. Bring along plastic bag for laundry and also for rubbish. The hospital prepare clothes. If it's blood stain, you can always ask the nurses for an extra new set. Now, let's move on to the baby's bag. You don't need to bring everything. Best pack in ziplock bags of a set of 4 to 5. In each bag, have a pampers of newborn size and a set of baby clothes with its mitten and booties. And label it so when you go to the labor room, give it to the nurses there. Bring along 3 sets of sleepsuits for your baby and also swaddle and towel for them. Preferably to bring small toiletry sets including essential oil for your baby. You may need to bring 20 sets of newborn napkins for your baby. Breast pump and also binders are optional. If your baby is warded, you might need it for your engorged breast. If you have a cesarean section, then your binders might not be necessary. During this pandemic, never ever forget to bring your mask, your fabric mask, and also your sanitizer. I have also prepared a digital checklist for pandemic delivery prep. Check out in my Facebook page and send it to all the mothers out there. Oh, don't forget your car seat all set in the car, and we are all good to go. Praying for a safe delivery for all the pregnant mummies out there. Bye! I'm Dr. Catherine, your OBGYN.